I want to also talk a little bit about degenerative disorders. They seem to have almost a incapacitating effect on the elders, be it dementia, Alzheimer's, Parkinson's. What are things we can do to sort of help our elders navigate those phases? And how do we understand that?
In the last 20 years, there's been quite a bit of research in the degenerative disease field, as you've explained a few examples there. And these are challenging conditions, and the research and evidence is evolving. And from the background of exercise sciences, what it shows is that even at the different stages of disease progression, exercise can be beneficial. So, for example, at the London Health Sciences Centre, they had a Parkinson's exercise program long time ago. So these are exercise programs that brought together patients with Parkinson's to provide customized level-appropriate exercise program that was supportive of enhancing sort of muscular flexibility, enhancing strength, and so on. I'm really encouraged with the science that we see. For example, in dementia. In the past, we thought you were born with a certain set of neurons, and when you lost them, you lost them. But modern research shows that the nerve cells neurons connect each other, as even through the disease progression, through medication, for example, exercise, novel tasks, trying something new has been shown to create neuroplasticity. And so enhancing the connectivity between neurons as people age. So there's a lot of promising research that's coming out of fields of regenerative medicine.
And as young men and women in our, let's say, middle age, how do we ensure we are preserving this neuroplasticity? What can we do to make sure we remain neuroplastic at an advanced stage?
Mm-hmm. So education is a great thing. They have been studies. There's a nun study. It's one of the oldest studies where a group of nuns who sort of kept record of their day-to-day life, who read more actively, had much more neuropreservation as they got older. So reading and engaging in new material is good. Physical, functional exercise and other practices are important. Not smoking, those kinds of unhealthy practices or minimizing them has been shown to be effective. Furthermore, the environment also has a huge role to play. And so there's been research to show environmental exposure causes problems. So being aware of those kinds of environmental practices or factors would also be important.
And an elderly person sort of undergoing this degenerative disease is still subjected to some bit of stigma, meaning when they are in a social setting, people look at them differently. How do we, as society around, how do we accept and how do we help this person lead a more normal life?
Absolutely. I can't agree enough. There's so much stigma around conditions such as dementia. I have my former postdoctoral fellow did a fantastic series of work highlighting and documenting the stigma that we see in the system. And furthermore, she's gone on to develop interventions and opportunities, resources. For example, she's created awareness kind of approaches, action-related things as to what can people with dementia or people who are caring for people with dementia can do. And so there's a number of opportunities there in terms of learning about these diseases. Given the rates that we see, it's possibly coming near your own circle of influence. It's a relative, it's a friend, and so becoming aware is an incredibly important first step.
It's, I've had first-hand experience of some of those, and I think it's a life-changing experience to be around somebody with dementia or even early-stage dementia, leave alone advanced Alzheimer-like condition. Clearly, to tackle this breadth of elder care, say, propositions or elder care situations, the set of skills needed. I mean, you have the patient facing, an elder care nurse or a physician. That's just a very small army. We talked earlier about big data. We talked earlier about how public health systems are now increasingly built using data. Help us understand that prospect with some examples, and possibly what could an AI engineer do in this space of healthcare and public health systems largely?
So a number of cool ideas are emerging from the field when the fields are talking to each other. So one project that we've been beginning to work on, we've submitted an application, is to look at social isolation in seniors with the AI platform that services seniors in rural communities. So it is using social network as a theory of computer science into human application. That's one example. We have researchers who are identifying advanced molecular compounds that can then become part of medication that addresses a condition. So we have analytical chemists in our own university who is sort of doing molecular diagnostics using AI. So there's a number of interfaces that can be created from people pursuing research. I think globally as well we have opportunity. Canada is about 40 million people, but India is much, much larger and has incredible diversity. When countries and countries can come together, the solutions that we can bring about from thoughtful understanding of the issue, systems alignment or support that we need to provide in place is incredible if we can begin to work together on complex issues like this.